For example, with Alzheimer's disease, that tends to affect the posterior back parts of the brain more than the front parts of the brain. These patients have trouble with their visual attention, so understanding visual information, potentially not recognizing the faces of one of their loved ones in a condition called prosopagnosia, meaning not knowing the face. And the opposite is true as well if there is an illness such as frontotemporal degeneration that affects the front parts of the brain, then the back part of the brain tends to work overtime, and these patients may develop something called utilization behavior, where they feel compelled to act on things in their environment. The patient example that we had today was someone who had office supplies sitting in front of her, and even during her clinical examination couldn't resist the urge to use the stapler or to use the tape. So we have treatments. We are able to treat the symptoms of neurodegenerative disorders like Alzheimer's disease and frontotemporal degeneration. What we don't have right now are therapies that modify the disease course. So even while we're treating the symptoms and importantly treating the family that's dealing with this, we don't have the interventions that will stop this from being gradually progressive. So in my day-to-day, I think that it's important to recognize the valuable aspects of my patients' lives, although some things may not be going so well and they may not be able to recognize their loved one's face, or they may not be able to stop themselves from using a stapler or emptying a box of tissues, that sometimes the other parts of their brain are working very well and may even be working better than they were before. So we talked about some patients who have a neurodegenerative disorder that causes language dysfunction, a type of frontotemporal degeneration that causes aphasia, who have been described as developing unique and improved artistic talents. So they've become visual artists. As their language is increasingly impaired, they become much more skilled at producing visual art. And so this is described as paradoxical functional facilitation, meaning that one part of the brain does a better job even as another part of the brain is suffering.